Welcome back to Healthwise. With us again is Dr. J.Y. Bordelon with the Opelousas General Sleep Center. Doc, I think before we get started, we want to show some slides, and you can kind of explain to the audience as we go what they are.
First slide is outside of our sleep center. We're located on Natchez, kind of at the back of the hospital. We hope to have a facility that would blend in with the residential neighborhood and transition from the hospital. So that was kind of what we tried to obtain with this. The next picture is Lynn and one of our patients. And Lynn's kind of fitting the patient with the CPAP mask. And what we do with sleep medicine is mostly dealing with sleep disordered breathing, and a lot of it is dealing with CPAP. This is Paula getting one of our patients ready for a sleep study. A lot of electrodes that we put up. It takes about a half an hour or so to put all of these electrodes on. During the night, the patient is monitored with everything from brain waves to airflow to EKG and oxygen saturation. A whole set of electrodes go on, and you can see just a few of them being put on right now. After the sleep studies are collected, we go through the study, and here I am with one of our techs scoring the study, where we determine what stage of sleep the patient's in, whether respiratory events are occurring, whether there's seizures, leg movements, or other disturbances to sleep. And the first part is the technicians get that ready for us, and then we'll go over the study afterwards and review, and then finally meet with the patients afterwards. This is Lisa, one of our techs, going through and scoring, and you can see there's a whole set of lines going across the screen. All the different electrodes show up on the monitor, and we have to keep track of that throughout the night. There's a video as well that shows pretty much what's happening if the patient has any movement disturbances or unusual positions that might be helpful. We see adults and children, and here's John Buller with one of her child, actually, getting set up for a sleep study. And Tricia with another child, a little bit older. Again, we'll see from children 2 years of age all the way up to people in nursing homes. So the whole range of society has sleep problems, and we try to deal with those.
Okay. Well, Doc, let's talk about how do you choose, if I was going to choose a sleep center or the audience, how would they go about that?
Well, I think that there are a couple of things you want to do. The first thing is you want a facility that's nice, that the sleep is not going to be disturbed. So you don't want to be in the middle of a hospital ward where there are people going up and down all night long. You want the staff to be accredited and licensed. Louisiana, one of the things we've done well is we're the first state to require the sleep techs to be licensed and registered. And the rest of the country was like, wow, what are you doing here? So that was one of the things you want the techs to be licensed, registered, you want the physicians to be board certified in sleep medicine, and you want the center to be accredited. So you want those things, and then after you get your sleep studies done, you want them to follow up. A lot of times we'll hear that somebody will have a sleep study, and nobody ever really sits down and talks with them and explains what happened. And to be successful in treating these disturbances and getting somebody to go home and actually use that mask, they need to have an understanding why. They need to appreciate the seriousness of the complications if they are not treated. And so often patients don't realize that they have a problem. Right. It's the family that realizes.
Well, that's leading into the next part. What diseases do you treat at the sleep center?
Well, the main thing is sleep disordered breathing, obstructive sleep apnea. We also will see patients with conditions like narcolepsy, shift workers, people that work to keep our society moving. The people are working night shifts and day shifts, and it creates problems with their getting enough sleep and quality sleep. Children that are getting to the point where they can't go to sleep at a reasonable time, and then when they become more adults, they have trouble adjusting to getting up at a normal time. Those are circadian rhythm disturbances. Similar elderly patients may go to sleep very early and not be able to sleep throughout the night, and they come in saying, how come I'm waking up at 2 o'clock in the morning? Well, it's because they've been sleeping 8 hours.
Right.
But it's dealing with a variety of problems. Insomnia is one of the more common things. Most of the insomnia patients, I guess, are short-term, but there are some that have more serious problems, and we do see a few of those.
Okay. Well, and you mentioned earlier when you showed someone them putting on the CPAP mask and stuff. You know, I'm a little familiar with that because on the ambulance, sometimes we have to do that. And so you know, I noticed earlier you had said you was in the pulmonary, medicine first. So a lot of people don't realize, but I guess you could tell them is that similar. You know, you've got some.
One of the first experiences, I guess, with that got me interested in sleep apnea was a patient that we were seeing in the hospital that was having a lot of difficulty breathing and actually progressed into heart failure and problems. And it wasn't until we got her in the hospital and was sitting there watching her that we realized she wasn't breathing, and that was what was leading to the complications. The mask that y'all use a lot of times, BiPAP, to patients that are having respiratory difficulty, that can sometimes prevent them from being on a ventilator or having a tube put down their throat, and it's made a big difference in keeping a more complicated procedure, and because of that, you shorten the length of stay in the hospital a lot of times. But snoring and being tired bring people in, but it's the complications that really warrant the need for the treatment.
Okay. Well, Doc, hold on to that thought, and we'll come back to some more questions and some more information about the Opelousas General Sleep Center after this brief message from our sponsors.